Good morning, everybody. Good morning, my friends. How are you today? I'm continuing my topics on animal diseases as a veterinary pharmacist. I want you help to identify it and help. There are some disorders that your pet has, and I want to help you how to properly treat your cat. I'm not veterinarian. I'm just veterinary pharmacist. I mostly help you to understand veterinarian pharmacy, which is some medication that your pet has to take if they have any health conditions. So today, me and my cat, her name is Murka, will talk about feline diabetes. Feline diabetes, it's pretty rare, but it happened. Approximately one cat on a 400 of cats has diabetes. It's a pretty bad condition, but it's curable, it's treatable, and the patient can live with it until they die and live long life. So unless you administer them some medication that your veterinarian prescribe. So, what's the signs of diabetes in pets, in cats? It is loss of appetite. Usually, it's pet who is overweight has its kind of conditions. Also, risk factor, it is being older than 8 years old and being male, not a female, luckily, right? So, if your pet, you notice your pet drink a lot or eat a lot and obese, so it's called polydipsia, polyphagia. That may be a sinus diabetes. He's lethargic, and you see he's has a difficulty do any activities. So you go to see veterinarian, and they probably need put him on some medication. Diet is very important as well. So usually they put them in the diet like a low carbs diet like canned food. But pate is usually works better than those sort of like a strings. That's what my cat eats. She likes pate, chicken, or fish. That's why I recommend to give it to her, to your pet. After your veterinarian prescribe you your depending on condition, he will prescribe you some medications like glipizide or a usual common medication. It's insulin. Very important to know the doses. Whatever your veterinarian prescribe usually doesn't exist more than 1, 2, or 3 units. Very low dose. They usually comes in a little vials like this for about 10 mLs. So before you administer, you gotta get a syringes, like a small insulin syringes, and rotate between your hands, not shaking, just rotating and warming up a little bit, and draw 1 unit and do some injections either in the neck, but usually in the thigh, right there. So that's a typical injection site. Approximate dose, like I said, from 1 to 6 units twice a day before meal or with a meal. It's like your postprandial insulin. One of the common side effects from insulin, it's hypoglycemia. If your cat became hypoglycemic, which is, you notice right away, she's shaky and nervous, and her blood sugar less than 60 milligram per deciliter, you immediately give her something sweet like corn syrup. Let her lick corn syrup. Just a little bit, put on your finger or rub on her mouth. That helps her to raise the blood sugar. Also, common medication is glipizide, sulfonylurea medication. That's very common in humans also. Humans use glipizide for diabetes. Give it about 2.5 milligram tablet, up to 5 milligram tablets, also twice a day with food or right after meal. Very simple, but this is medication helps also to low insulin in the blood, glucose, I mean, and increase insulin production. It is also cause hypoglycemia, so watch for the signs of symptoms of hypoglycemia. When you start any medication for your pet, monitor them about 1 week. See how the medication works, if any improvement of any side effects. So then it's, let's say side effects last more than 7 days, immediately contact your veterinarian. I would recommend to also, during 2-3 weeks insulin therapy, you monitor blood sugar. It's like a home, by the home monitor, in the blood sugar monitor, and monitor sugar level for about 4 weeks after you start insulin therapy. After months insulin therapy initiated, cat with diabetes should undergo complete physical examination check and do the lab test. That's what your veterinarian will tell you to do. So as a pharmacist, like I said, I suggest administer insulin with the food or after. Do not change the dose unless it's directed by physician. Do not shake a vial unless you have a vial of porcine insulin zinc suspension. It's called Vetsulin. You can shake that vial. A regular insulin, zinc protamine insulin, you just roll between your hands. Use marginal ear vein or pipettes to obtain a blood sample. It's right here, blood sample right here. They will probably teach you at the vet clinic. And watch for signs of hypoglycemia again, restlessness, anxiety, weakness, difficulty standing, or ataxia, which is no movement, tremor, even seizures, sometimes coma. But I hope you're not gonna do, hope it's not gonna happen. All right, and that's what completes my lesson about feline diabetes. And if you have any questions, contact to me. If you like this video, put like. And also, don't forget subscribe for my channel, because I'm going to be more with the videos about my favorite pets. And if you have any questions, contact to me on my website, www.wholesomepharmacy_.com. Thank you so much. I will talk to you later. Thanks.